It's now time to proceed on to health and nutrition. The hostess here is Dr. Lalita Kaul, who is a teaching professor at Harvard University College of Medicine. Today, Dr. Kaul will talk to you and I about food and supplements and their use and abuse. Let's take a close look.
Good morning. Today I am going to talk in health and nutrition segment about supplements, use and abuse. There has been so much buzz about everybody using supplements, my friends, my colleagues, my patients, and some of them are good, but some can cause really serious problems. So when I was deciding the topic to talk about, I thought supplements, and I want to talk more at a very simple language. There are so much scientific research. So I have taken some notes from my books I have written on supplements. So to keep on the course, so I am going to read, actually these are the items from my book, and it is if somebody told you take a pill or drink a supplement and you will be fine, would you believe it? Of course not. Food is something which still gives us some unknown things. Food is the best. As supplement says, it can be only as a supplement. It is $1 billion industry, about $200 billion industry, and it has very sophisticated marketing technique, and some people, especially older people, fall prey to it. And so there are some supplements which are beneficial, and some if you are taking other medications can create a crisis, and it has happened during my practice when patients had to be hospitalized. That is why it is very necessary for the physician, when they are taking the history, to take the history, ask the patient what kind of on the counter. Most of them are without prescription, and physicians do not have a lot of time. In a 20-minute time, they have to take the history, medical, physical diagnosis, so they can have the patient write it up, or if they are sick, have the nurse. And sometimes the physician may not have all the answers. You have to research yourself. And in 1994, there was a DSHA, Dietary Supplement Health and Education Act was approved, where all the supplements are listed under that. It is under food and drug. But the surprising part is supplements are not as well regulated as are drugs. In fact, some of the drugs are available in Europe before they become available in USA, because there is very strict scrutiny, and there are people in desperation, they need it, they get it from Europe or some other countries. But you will be surprised to know the supplements are not. Any manufacturer can list it and register it with the FDA. So the onus is on the consumer. If they find anything wrong with it, so they have to report, and they in turn will. But in the past, the lobby was so strong that they couldn't do much, but that things have improved, and it is getting slowly more attention. So what happens is, once you report, you can go on the internet and they can report it. So I have a very personal, besides my patient, a personal story about it. A very dear friend of mine who was taking food he just lived on food supplements, raw food, milk thistle, everything, didn't eat regular food. What could the parents do? A 24-year-old man. And so he came one day home to visit, and he died in the bathroom, and it was called Last Smile. So to make it a story, you can see how devastating it is for a parent to lose. And so when he went to the ER, they said his heart stopped. He had never been to a doctor for a long time, and his heart had enlarged. And then ever since 4 or 5 years, the father has been trying to put a closure on it. What I am coming to it is, He asked me if I could look at his supplement history. He wanted to know what was happening. Again, it's confidential information, so he did send me by special delivery, and I looked. He was taking so many, he just didn't eat the real food. That's an extreme case. And I wrote a review for his book. On the documentary I interviewed, and he's lobbying heavily on the Congress for regulation. And so I wrote him that every drop makes a difference. But this is not to scare you about supplements. Some supplements are okay, but when they give you the false hope to the elderly, thinking they can forever, live as young as they could, they give a hope to a very sick person with HIV, with cancer, with terminal disease. But it's very, very important that you have to know what medications you are taking, because the interaction between the drug and supplement can be very serious. And there have been cases, one case I can tell you from my own practice. This lady wanted to lose before going to the wedding, and she took something and she landed up in the ER, and she had to postpone her wedding date. So anytime somebody promises you miracle, you should look at it, read it. Now, where some supplements can be beneficial, and in the interest of time, I can read some of you. For example, vitamin C, if you are smoking or your colleague or others are, then extra vitamin C is very good. Women who have heavy menstrual bleeding, so taking extra iron. Pregnant women, they need prenatal vitamins. People with some kind of conditions, medical, where they do not absorb, they need it. Those who are on restricted diet, they need it. And so it is important in some other ways. Now, the risks are if you consume in excessive amounts, and some have very undesirable effects, and they can affect your absorption of fat soluble vitamins A, D, E, and so you have to be very careful. And we have had children given massive doses by parents of fat soluble vitamins. They end up in ER. When the history is taken, they find out this was the thing, you stop it. Again, I am pointing these extreme cases, so you have to be very careful, the age, the conditions, the medication. So it could be otherwise very risky. You might so if you read, or on television is the big source of information these days, some people run, oh, I read this, I got to get it and take it. My advice is, please don't rush, see what you are going to eat, read it on a well-informed site. We have WebMD, PubMD, and see, and if sometimes physicians don't know. It's only since last 4 or 5 years I have included in the curriculum of medical students 2 hours lecture on food supplements. NIH has a branch now on food supplements and alternate medicine. I'm constantly updating that what scientific evidence we have to back this miraculous things. As I said, some of them are important and essential. Calcium, and women tend to be deficient, so we take the calcium supplement. Vitamin D, mostly most of the people are deficient because we are not exposed to sunlight, and which is very important. They are even talking about heart disease and vitamin D. I want to go in some of the things which are supplements, what is up there. Echinacea, which frequently people take, and the claim is it boosts immune function and protects against common cold, virus, upper respiratory infection. There is no solid research, it's just this in the middle. I know many of my relatives who take echinacea regularly. Nothing may happen, but be aware what the scientific research says. Now, people who have health problems with immunity, they will have reaction to it. And the people who are taking severe allergic reactions, some people have a lot of allergies, so they can be allergic. Garlic is very good in cooking. I am talking about this concentrated garlic, which is in the tablets, thousands of milligrams you take it. Not the regular garlic is very good, it does have help hypertension. The claims are that if you take extra doses, it will boost immune function and protect against common cold. Now, there is no research to substantiate. There are some isolated cases which has helped in the blood pressure. Now, do not take those concentrated doses in the pills. In cooking and all, it's okay. If you have problem with, you may increase bleeding, some people, if you take massive doses. Don't take it 7 days before the surgery. It may cause stomach discomfort. So, I am just picking a few which are common there. Again, you can find, and then ginkgo biloba, which many people take. What is the claim is that it treats morning sickness, treats post-surgery nausea, treats nausea associated with chemotherapy. But the research is in the middle. So, avoid taking before the surgery and can cause mild upsets. And again, you have to list the medications to tell which your physician will ask you, and then say you are taking this. Look it up, ask your physician. Now, the other one I will do very quickly go is ginseng, and it is supposed to be for say diabetes, for depression, but it can aggravate hypertension. So, again it is very important that when you go for any of these supplements, look your diet history, look at your allergies, look at your medications. Again, one case is one of the colleagues came, she was feeling very sick. I said, what did you change in eating? Nothing, same thing. I said, what are you taking? She gave me a lot of these names of food supplements. I said, okay, can you stop for 3 days? She was a little apprehensive. But then she says it cleared. I said, you're taking too many supplements. So, let's go each one which is good for you. And so, the green tea is another one which is good, I mean health, but some people carry it too far. They have continuously taken green tea. It may not affect you, but they are claiming it reduces cancer, improves heart rate, and again be aware how much caffeine it has. It might make you nervous, you may be taking too much, it will interfere with iron absorption. And so, if you are continuously taking and you are taking multivitamins, it has iron in it, don't take it. St. John's wort is used for depression. I had some patients taking it, but it can again with the hypertension pill. I had a patient saying her blood pressure has been going up. So, when I took the history, I said, why don't you stop this? Again, this is not to say all supplements are bad. So, what I am trying to say this morning is, you taking supplements, you decide to take new supplements, look at your history, read it up, check with your physician, and because the marketing is very strong, they will try to sell you, they are very aggressive about it. If they claim you can eat this and sit and do nothing, you will lose weight, you know something is wrong. Or you can go on the scale and just it will come down. So, my take home message is, you are surrounded by supplements, reps, your friends, but just don't jump and take it. Just take it very after doing a thorough. There is no rush, don't buy big jar bottles. Somebody is saying if you take one, you get one free. You should not jump and you should think. I am almost every week approached by somebody, if I could sponsor, if I can wrap. I said, no, I individualized. If that product is good for somebody, then it is good. So, I hope you got some information on supplements this morning.